For many years, public health has diligently served communities across the Commonwealth. Often behind the scenes and many times unnoticed, we have been there to safeguard our communities against disease. We have been there to lessen the burden of poverty through the WIC program. We have stood on the front lines during disasters to preserve the health of the community, even among chaos. And when the eyes of the world were on Kentucky, public health was there to ensure the health and safety of not only Kentucky residents, but of those from around the world. Because of public health, there is someone to keep a watchful eye on diseases that, should they go unnoticed, could develop into detrimental epidemics. We are shielding you even as you go about your daily lunch routine, and we are there to protect you even at home. As experts in preventative health strategies, we take on critical roles that are exclusive to public health and not fulfilled by any other agency in our communities. But circumstances could drastically change as we look into the near future. As most of you know, Governor Matt Bevin's proposed biennium budget address on January 16th appeared to indicate that all required increases in retirement cost would be covered with state funds. However, local health departments are not covered because we are a quasi-governmental agency. This means all 120 local health departments in Kentucky have a liability for $38.5 million for retirement expenses for our workforce. Faced with this harsh realization, health departments would have to make significant changes to the detriment of their community. To supplement this change, we would have to reduce the local health department workforce by 35%, leaving programs lacking staff to carry out critical duties. What would it mean to reduce our workforce by 35%? Well, here are just a few of the many changes we would see. This drastic decrease would mean pediatric services would be reduced by nearly 22,000 Kentuckians. It would mean that WIC services would be reduced by nearly 60,000. Tuberculosis services would be reduced by over 18,000. It would mean that funding for vital environmental services would be cut 50%. It could mean taking a step backwards and adapting to a new reality. Whether we have to deplete program funding or decrease our workforce, the ones who are most negatively affected are those in our community. But the good news is you can help. By making the decision to fund local health departments' increased retirement cost, you can ensure those in our community continue to receive the necessary public health services.
Your decision affects me.
Your decision affects us.
Your decision affects me.
Your decision affects me.
Your decision affects us.
Your decision affects us and the other 119 health departments across the Commonwealth.